Online communities are virtual spaces where people can meet and usually have something in common to share, such as liking a particular TV show, being a fan of a sports team, or having a hobby or other interests. Online communities have also formed for health-related issues, such as online groups for weight management and for people with chronic health conditions, so that they can meet people going through similar experiences and challenges and learn from each other in managing their health. An example of one of these conditions that a person might find an online community for are tic disorders, such as Tourette syndrome. Tic disorders aren't exactly rare, but they're not that common either, so it can be tricky to meet other people and families near you who are going through similar experiences. Furthermore, it can be difficult to predict the course of tic disorders. Some might only have tics for a short time of life, while others may have tics for years and into adulthood, and in the meantime, people find ways of coping and living with tics. These are just two reasons why people with tic disorders and their caregivers might look for online communities to help manage their ongoing tics, but so far there's not been any research looking at online support groups for Tourette syndrome and tic disorders. In summer 2019, we created and shared an online survey to ask users of Tourette's and tics online communities some questions about what originally led them to an online community for Tourette syndrome and tics, what benefits and drawbacks they've experienced from using these online communities, how online communities have helped them manage their tics or how they help support someone they care for with tics, such as a child, and whether online communities have helped them in other areas of life too. Overall, 90 people from 13 different countries took part in the survey. This represented people with Tourette syndrome and tics themselves, people who are caregivers or a close significant other to someone with tics, such as parents, siblings and partners, or it could be that they fell into both of these categories. Many of the respondents to the online survey reported using online communities for tics several times a week. Looking at what was found from the online survey, understandably many mentioned that they were led to online communities due to the lack of offline support available for tics, and online groups were a lot more accessible regardless of time and location. Online communities provided access to a space where they could meet and talk to other people with tic disorders or other parents regardless of where they lived. The people who completed the online survey mentioned online communities helped in understanding what health services were available for tics, and advice to aid getting a diagnosis meant that they could share tips and advice for managing tics, as well as understanding other health issues that often go along with Tourette syndrome, such as ADHD and OCD, and it also helped in learning how to explain tics to other people. The answers also revealed that online communities provided a space to share experiences safely, a place to feel accepted and to give support back to others, and feel less isolated in having Tourette syndrome and tics. Another reported benefit from survey respondents was on their own psychological well-being and a shift in their beliefs and attitudes about tics. Some stated that participating in online communities helped them feel more confident in themselves and accepting of their tics, reduce the self-blame they may have placed on themselves for having tics, and seeing others talk about their experiences provided hope for being able to cope with tics in future. Many said they wanted to pay it forward with what they'd learned, and said sharing their experiences was useful to new members of online communities who may only recently have developed tics or had a diagnosis. So far the findings have highlighted many benefits of online communities, but they did report some drawbacks as well. The suggestible nature of tics, that hearing, reading or watching other people tic can then lead to you having tics, was described as one of the main difficulties of being part of online communities for tics. Additionally, some mentioned that while hearing about other people cope with tics provided hope for their future, being part of online communities can continually remind them of the many difficulties and challenges they might experience due to having tics. Also, as often found in other online health communities, some respondents mentioned concerns about the advice given in these online spaces and how they see some groups as not allowing discussion on certain topics. Finally, some reported some conflict between members. In particular, this was about members who have tics and the parents of children with tic disorders. This may be somewhat understandable given that tic disorders often emerge in childhood, and so parents want to seek out help online. But respondents to the survey mentioned that some parents may be more vocal in online communities compared to people who have tics. But at the same time, there's also much that parents can learn from the insightful experiences of people with Tourette syndrome and tics. So overall, the answers from the 90 people who completed the online survey provided a great insight into online communities for tics and Tourette syndrome, and told us how exactly such places can be helpful for them in gaining some control over how they live and cope with tics, such as having increased knowledge about tics and helping how they talk to healthcare professionals about their tics. Online communities appeared to help beyond tics as well, in also aiding people's mental health and how they felt about themselves too. If you'd like to read the full paper describing this study or have any questions about it, please go to the following website or email us. Thanks to everyone who shared our online survey and to the 90 people who completed it. We really appreciated the time and effort you put into completing the survey.